Hello? I'm gonna turn on the light. Hi, Mr. Jones. Sorry, pretty bright. How are you doing today? Pretty sleepy still? Yeah? Okay, my name is Claudia. I'm gonna be your nurse here today, okay? Do you have a nickname or do you like to be called Mr. Jones?
I like to be called Ethan.
Ethan. Okay, Ethan, nice to meet you. I just wanted to explain where you're at right now. Can you tell me where you're at right now?
Hospital.
Okay, what city?
I don't know.
Okay, you're in Yuma. And do you know who the president is?
Not right now.
Not right now. Okay, it's Barack Obama. All right, so it's Friday today, okay, October 3rd. And I wanted to explain to you why you were here in the ICU. Your mom brought you in. Apparently, my understanding is you are visiting from college, and you're currently attending university in Flagstaff, and you take your own insulin, and you weren't feeling so good, and you haven't taken your insulin for a few days. Is that my understanding? How many days has it been?
4 days.
4 days. Okay, let me just look at your ID band real quick, okay? Alrighty. And you're how old?
19.
Okay, you were born in what year?
95.
25, okay. Alright, so, so you weren't taking your insulin, and you're a diabetic, type 1, since age 7 is my understanding? Okay, your only other history is you've had some allergic rhinitis to your nose, and then you had pneumonia as a child. Other than that, you've been pretty healthy, kind of keeping up with your diabetes. Your parents have been helping you maintain your diabetes under control, and now you're kind of off on your own and over in college, and kind of have to do everything on your own now, so kind of have to learn to be a little bit more independent. So I understand you were sick, and the 4 days of not taking insulin, is that correct? Caused your blood sugars to go skyrocketed. So your sugar when you came in was like 550, so it was making you very tired and very sleepy. So your mom was concerned. She couldn't wake you up, and she checked your sugar at home, and it was very high. So she brought you in. Part of your sugars being really high is something called DKA, which is diabetic ketoacidosis. Do you understand what that means?
No.
Okay, when your sugar is to a level where it gets so high, then your body starts to change it into acids in your blood. And those acids build up in your system and cause you to be very sleepy, to almost, you could go into a coma if your sugar gets so high. So it's very concerning, and it's very destructive to organs in your bodies, okay, organs in your body. So some of the things that can trigger that are an infection, stress, and I bet this whole movement over to school, and are you taking a full load of courses right now?
Yes.
Yeah, okay. So that new food that you're not used to, all that kind of comes into play and has caused maybe some new stresses in your body that has caused you to get this sick. Okay, so we're going to try to get you back on track. So just to start with right now, I wanted to just do a full body assessment, and then we'll explain what the plan of care is and what we're doing. Okay? All right. So I'm going to clean my hands again. All right. First of all, I'm going to take your vitals. Okay. You take your temperature. Your temperature is 96.1. Your heart monitor says that your rhythm's regular, and it's about 110, but I'm going to go ahead and check your pulse anyway. Okay. I'm looking at the clock over there, and after 1 minute it says that you're about 110, so those are a little bit signs of dehydration. Your blood pressure, it just took it, and it is 88/59. 58/59. Okay. So the first, your respirations, let me count those. Your respirations are about 28, And your mom also noticed that you were breathing a little abnormally. Your respirations right now indicate that they're about 28, that you're breathing a little labored, and those are also signs of your blood sugar being really high. Okay. I'm going to check your blood sugar again. Grab some gloves. You're pretty used to poking your finger and doing all the sugar checks yourself. You have all the equipment at home. You have the glucometer and the pokers and all that, the lancets. Okay, now just take a finger, poke. All right, now we'll see what that blood sugar is, okay? All right, so you came in with a sugar of 550. It's saying it's 440 right now. You are getting, we're hydrating you with lots of fluids to help bring the sugar down. And we've also got a continuous insulin going, and that is helping bring down your sugars also slowly. We're going to be checking your blood work quite a bit here while you're here. Blood sugars are going to be checked probably every 1 to 2 hours. And we'll be adjusting your insulin. Right now it's weight-based. Your height is, according to the documents, is you're 5'8" and you're 79 kilos. Does that sound about right? Okay. All right. Any family history of diabetes that you know of? No? Okay. All right. So we did some lab work, and we're hoping that that results and lets us know what's actually going on with you. Okay? And maybe you're brewing some type of bug that we haven't quite caught yet. All right, so change my gloves real quick, and then I'll do your full body assessment, okay? So I'm going to be looking at your front side, your back side, and I'm going to have to look at your privates, and I'm sorry, I know that's usually not normal for you, but I need to do that just to look over your whole body, okay? So I'm going to start with your head. And I'm going to look for any bumps, any cuts or anything that have happened to you lately. Did you fall or any injuries or anything like that? No. Okay, there's no lumps or lesions. Let me open your eyes, please. Okay, you're still pretty tired, huh? Okay, wake up. All right. Okay, your pupils are good. Where did my light go? No, I'm going to check your pupils real quick. Okay, so just stare straight ahead. And I'm going to look at your eyes. And they are symmetrical, pupils equal, reactive to light, corneas are good, scleras, there's no swelling or edema. I'm going to look in your ear, I'm going to look in your ear with the otoscope. Okay, just turn your head a little bit, otoscope, and I see no redness or swelling in there, there's no drainage. I'm going to look at your other side. Same thing, no swelling, no ear pain, no nose pain, no throat pain, no issues. Okay, can you open up your mouth? I'm just going to look in the back. Say ah. Okay, tonsils are good, they're not swollen. Your tongue is a little dry. Your lips are very dry and cracked. Okay, have you been drinking a lot? Been pretty thirsty, huh? Yeah, and you've been peeing a lot? Okay, those are all signs of DKA, okay? So those are all normal signs. Then I'm going to look at your throat. Okay, your trachea is nice and midline. It's not deviated at all. Your veins are nice and flat on your neck. Then I'm going to check out your breathing. Like I said, it's a little labored. I'm going to take a listen at you. Clean my stethoscope. And alcohol. I'm going to listen to your front side and your back side. Just take a deep breath. Deep breath. Chest is symmetrical. I'm going to lift up your gown just a little bit. Okay. There's no accessory muscle use. Okay. Do you think you can sit up for me? Okay. Your oxygenation is 94% on the monitor. It probably should be a little higher, and that's why I have a little bit, 2 liters of oxygen on you, okay? Okay, so take another deep breath. Good. That's nice and clear. Again. time? Okay. So has it been pretty hard to breathe? Trying to exercise? You've been getting more short of breath?
Yes.
Yeah, especially up in the altitude up there, I'm sure. You just take a listen to your heart, okay, while you're sitting up. You can just breathe normal. Okay, it's nice and regular. S1, S2. Okay, lean back, no murmur, no adventitious sounds. Okay, I'm also going to take a listen to, let me look at your nail beds. They're nice and pink. Cap refills less than 3 seconds. Let me look at your carotid pulse. It's nice and regular. Okay, let me take a listen at it too. No worry or thrill. Okay. Let me check on your radial pulses. Bilaterally, or 2+, actually bounding. They're pretty good, pretty strong. Okay. Now let me look at your, let me just listen to your groin a little bit, okay? At your artery, that's good. And I'm going to go down to your feet. I'm going to uncover your feet just a little bit. Okay, dorsalis pedis, both tibs, both sides, 2+. That all looks good. Okay, now let me look at your belly. Okay, so you haven't been eating. So when was your last bowel movement?
Yesterday.
Yesterday. Okay, was it soft or regular or normal? Normal? Pretty normal? Okay, no diarrhea or anything like that?
No.
Okay, so I'm going to just touch on your belly a little bit, okay? That tender? Not really? Okay. And you vomited last?
Yesterday.
Yesterday. Okay, that was the last time you ate also?
Yes.
So you haven't been able to hold anything down, huh? Okay, I'm going to just take a listen at your belly. Okay, listen in all quadrants for a minute, and bowel sounds are active. If we're active, I'm going to, any problems peeing? You've been going quite a bit
Yes.
with all the drinking that you've been doing, okay. All right, and that's normal for what's happening with your body right now, okay. I need to look at your skin now. Look at your backside. You want to roll that way, and then I'll look at your. So what I'm looking for, is there any cuts or lesions on your body that aren't healing very well? When you have diabetes, look at the back of your ears, your head, I'm going to pull down your pants just a little bit to kind of look at your backside. Okay, there's nothing there. All right, nothing on your legs, any scabs or anything that aren't healing very well. You can go ahead and lay back. Everything was good there. Okay, sorry, we got your oxygen there. Okay. How about your toenails? You've got some ingrown toenails. Do you go to anybody get them specially cut, like a podiatrist or anything like that? No. Okay. You always want to make sure that you don't get any cuts or nicks, and make sure that you monitor them when you do get them, because when you have diabetes, you tend to heal slower. So now I'm going to check your body strength. Can you go ahead and squeeze my hands? Other side. Hey, can you smile for me? Smile? Okay. Now, you're not too happy about being here, huh? Go ahead and squeeze my hands. Squeeze my hands nice and strong. Can you raise them up for me? Okay. All right. Now bend up your knees. Can you bend up your knees for me? Yeah. Okay, your muscles are going to ache right now with the acid buildup, okay? All right. Are you sore right now? Have you been having cramps in your legs?
Yeah.
Yeah, okay, so those are part of your electrolytes kind of being off balance. So that's pretty normal. Let me just write some of the stuff down, okay? All right, so, any problems with your vision?
No.
No, okay. When I was up by your by your face, I noticed that your breath was a little fruity, like it kind of has a sweet smell to it, and that's part of the sugar process, okay, and the acids that are built up in your, it's part of DKA also. All right, any sore throat? No? Okay, all right. So you've been telling me that when you're exercising, you kind of get a little short of breath. Okay, that's part of it also. You're kind of gonna breathe different. Your mom kind of noticed that you were breathing a little abnormally. Okay, so tell me about your support systems up there at school. Have you, who is your main support system? I know that your parents are here and they used to help guide you and help do everything for you. Now they're not there, so you're kind of on your own. Have you communicated with anybody on campus, like the campus clinic or anybody like that to help you yet? No. Okay. So you most likely here in Newman County have had a pediatrician all your life, the same person since you were little, since you developed diabetes, and then you've been cared for by that person. So what we need to do is probably help you establish a physician over there so that you can be followed through and get the care that you need, and probably get you connected with a school nurse and possibly certified diabetic educator to continue learning what you need to know about diabetes and how to care for yourself. The nurse on campus is a great person to talk to. She probably might have some contacts to refer you to for a diabetic educator and a dietitian to help you with your diet, because what mom was helping you at home, because she knew how to count on your carbs and your proteins and everything that you needed, but now that you're up there, you're just kind of eating your own. Have you learned quite a bit about your diet, or you still need some more education on your diet?
There's some more education.
You probably do, huh? Okay, so you have some roommates. Do they understand that you have diabetes? Not really. Okay, it'd probably be a good idea if you let them know that you have diabetes, and so that we can provide them with education, so that there's a lot of peer pressure at your age, especially a new student in college trying to eat everything that they eat, and you have to learn to adjust, and they can help you adjust. Friends are really good about helping you with your dietary needs and watching you. They probably watch you a little bit more than you watch yourself sometimes. But we need to make sure that they're aware, so that if they ever see you have symptoms of, like you were having today when you were too sleepy, you didn't drive here, did you? Your roommate drove you, right? Well, that's a good thing. That's a good thing, because you always should make sure that your sugar is good and normal before you get into a car and start driving, because you don't want to cause an accident or hurt yourself or hurt anybody else. How about religion? Do you have a specific religion or faith group? No? Okay, are you pretty active? Do you get pretty down about your disease, or?
Yeah.
Sometimes, yeah. There's always help out there. There's a lot of support groups that can help you talk online, or a lot of kids that have diabetes that can, you guys can talk about it and learn from each other, to learn what their experiences are and what you're experiencing, and a lot of times you're kind of experiencing the same thing, so it's kind of helpful to talk to people that have diabetes type 1 and kind of are going through the same thing that you're going through. I'm sorry, I'm talking a lot, and all you want to do is sleep right now, huh? But that's okay. So it's good that you have that. How about school events? Are you going to the football games in the dome over there? Have you been to any of the games yet? Not yet. You probably, you need to get out there. You need to, stay active and continue trying to exercise. I know that right now, because you've been sick, you haven't been able to, but normally your mom said that you exercise like 3 or 4 times a week and you stay pretty active, so that's good. Keeps your circulation going, and heart disease and other things, other organs get affected when you have diabetes, so it's really important that you stay active, that you eat right, and that you monitor your blood sugars and keep them in control. Now, I want to just review what your medications are. So you haven't taken your insulin in about 4 days, but you take 10 units of Humulin regular and 20 units of Humulin NPH before breakfast, and then you take 10 units of Humulin NPH at bedtime. So that's your normal, and that's been keeping you good up to this point. Okay, your skin is, you're pretty dehydrated. We've given you about probably about 3 liters now of fluid. So we're trying to catch up on everything you've been peeing out with that, with all your electrolytes too. So we're going to be replacing your potassium and all that. But your skin is still, your lips are dry, they're cracked. We're going to continue to be giving you a lot of IV fluids, and your skin is kind of dry and leathery, and those are signs of dehydration. Now let me check over your IV site. Is that painful at all or anything? No? Okay, it has a good, let me check see if it has a good blood return on it. Okay, just flushing some saline. Okay, it's got a good blood return. It doesn't hurt or anything. Looks good. So right now I'm going to continue doing your insulin, provide you, when I leave here, I'm gonna go review all this with the doctor who is called the intensivist. I believe Dr. Jekyll is on today, and he'll be coming in and talking to you a little bit about what the plan is. So he'll be your doctor. There are doctors here in the ICU. They kind of rotate. They're called the intensivist, and they'll be in and talking to you about your labs. Every day we'll be drawing, like I said, lab work and monitoring you pretty close until we get your blood sugars back to baseline. We also have a case manager who helps you coordinate, let's say if you have any equipment or any follow-up doctor visits or anything like that, she'll help you coordinate all that care. And there's also a certified diabetic educator that is going to provide you some education, possibly some booklets, some online websites that can help you. And the dietitian is going to come in and kind of give you a little bit more information on your diet. And we're going to be giving you, like I said, fluids, antibiotics, so that we can get you over this infection, possibly bug that you might have once we find out what it is. Okay? Do you have any questions for me right now? A lot of information, I know. And Mom said she'd be back in a little bit. She wanted to go shower and rest up, and she'll be back in to see you. Okay. So do you have any questions right now? No. Okay. The board there lets you know what day it is, and my number and my name is up there. So if you need anything, you can just call me. You have your cell phone, then I'll be providing the phone for you over there from the closet, and then also the call light. This is the call light, so if you need the nurse, you just press on this button. Okay, so you I'll put it handy here. So if you need anything, you can just use that. Okay, so I'll let you rest, and I'm gonna just go chart everything and let you sleep. Okay. Well, thank you, Ethan, and I hope you feel better. Minute. Let's make sure.